Hello everybody, welcome to my channel. My name is Margaret. I was born with tricuspid atresia, and this whole YouTube channel is dedicated to the CHD community. And today I am interviewing 3 patients who have diagnosed CHD, as well as had a journey with mental health, whether that be diagnosed or not. So today we're going to dive into some interviews. Our first guest is Scott, and Scott, would you be able to introduce yourself, maybe start with your CHD?
Yeah, hello everyone. My name is Scott. So the CHD that I was born with was, it's called double inlet left ventricle. Basically, my right ventricle did not fully develop. In effect, I have one ventricle. And I also had transposition of the great arteries.
Hello, Jared. Thank you so much for joining me.
Thank you for having me. So my CHD is tricuspid atresia. So what that means is basically born without a right ventricular valve. But my last ultrasound, I was shown that there was like a little tiny baby ventricle that does no good though.
Welcome, Jess.
Hi, thanks for having me.
So would you mind sharing what your CHD is?
I have hypoplastic right heart syndrome. I have transposition of the great arteries. I have a atrial septal defect, and I have obviously ventricular septal defect because I don't actually have one of the ventricles. I've had 4 surgeries, the original Fontan and then the revision.
How has just living with this condition affected your mental health? Or if it hasn't affected your mental health, do you have a separate mental health condition or something that you're working on?
I've been diagnosed with ADHD separately.
A few years back, they diagnosed me with, I guess, depression, but I think that was also due to what I talked to was my alcoholism. So I think those go kind of hand in hand because what do they say, alcohol as a depressant.
So I have been formally and professionally diagnosed with ADD, bipolar 2, PTSD, and anxiety. I was diagnosed with ADD when I was 14. I was diagnosed with depression when I was 15. And anxiety, same time. And I was diagnosed as bipolar 2 at 31, 32 years old.
So I found out that I had, for example, ADHD a lot later in life. That is not how I would recommend to find out.
I was that type of person that was a really good kid until about 20, and then kind of all hell broke loose. The best way I can put it is a spree, 10-year spree. It was just like off to the races for 10 years. And
were there messages from your cardiologist on, hey, you probably shouldn't be doing this? Or did you not see your cardiologist for a certain period of time?
So for those 10 years, I was supposed to be on blood thinners. My crazy ass thinking was just like, oh, I'm drinking alcohol thins the blood. I'm doing blood thinners anyways. So I just said, screw it. Honestly, that's what happened. And so I really didn't see the cardiologist for like a good decade.
Do you believe that the timing of your diagnoses caused a lot of the frustration?
Absolutely. For the ADD, I spent, most of my formative grade school time kind of behind and trying to catch up because I didn't have the right support because I wasn't diagnosed until I was in my teenage years. For the depression and the anxiety, I feel like those were fairly timely diagnoses because I was a young teenager and that's usually when it comes about. The bipolar 2, it took the majority of my life to come up with that. And I felt like I lost a lot of time with improper diagnosis, improper medication, all of that. So that was probably the worst because it took so long.
You know, if your leg's swollen, you're like, if it's heart related, you know, oh, it might be some you know, excess fluid or something a little bit, you know, there's kind of an easy way, like I would know if it's something physical, right, to diagnose it. But with mental, without that knowledge, you're really just lost and you're very confused. So they were like, well, why don't you try this? I'm like, okay. And so I finally looked up the medication. I was like, oh, it's for ADHD. And with the way those medications, again, also with the Prozac, is it's not an instant thing. So it would take 2 to 4 weeks to feel the full effect. And it's not like there's like a measurement card, right, that you can clearly see. There's not an exact measurement like your blood pressure or your heart rate that you can figure out whether it's working. You just have to look back and be like, oh, I'm making less mistakes at work. Oh, I'm more organized. Oh, I'm forgetting my keys less, you know, that kind of thing. That whole process, I would say, from not necessarily starting, but say after I started taking, even after I started taking Prozac, but starting to find the medication to sleep, to finding the ADHD, I mean, I would say the process took about 5 to 7 years.
Like, here's a story of me going to just a clinic, not even a cardiologist, just go see like a regular clinic, and they told me, what's your alcohol intake, like one of those questionnaires, and I was just like, I'm just trying to be as not as honest as I could be, but I would just say I would have a couple a day. But then the doctor asked me even further into it, like, how many is a couple, and I'd be like 5 or 6, even though it was like twice that amount. And I mean, that's even when it was like I was new to drinking, not later on in life. Later in life, it was much more.
And do you mind me asking how you got sober?
You know, I don't know if you've ever heard of it, but you have to hit like a rock bottom. And it was like me having to hit a rock bottom to where I was actually finally willing to change. And that rock bottom was, I'll disclose that right here, but my rock bottom was I was homeless. And I was like, I need to change. But I was introduced to a 12-step program prior to that. And I went back and actually started putting action into that 12-step program. And that's when I sobered up for 2.5 years. And then I relapsed and then got back sober again.
So for patients who have CHD and a mental health diagnosis, would it be reasonable to say that you would want to contact your congenital heart doctor and say, hey, I think I'm experiencing some sort of mental health. Could you recommend a psychiatrist or a psychologist? Is that the way to go about that?
It is a way to go about it. I'm not going to say it's the way, because I found out a lot of it by trial and error. I still technically, I've been seeing counselors off and on for 2008, 15 years at this point. I'd say only 2 of them were any good.
I had to learn to find my voice. Like, I had to be able to say, listen, I respect you, but you're not listening to me. You know, somebody who's a psychologist or a psychiatrist or a neurologist or whoever, maybe has never heard of it. And so they're like, oh, well, you know, it's just like this structural defect and it's not really going to affect them for the rest of their lives or whatever. They have a very surface understanding. I found myself really kind of being a teacher in a lot of situations, because I'm like, okay, clearly you don't understand what this actually means. So let me draw you a picture of what my heart looks like compared to yours.
I remember one of the first things my counselor said was like, well, if you need to worry, just imagine like a stop sign. I was like, wait, what do you mean? She's like, well, if you worry, if you think you're going to worry, just imagine like a stop sign in your head, and then you'll stop worrying. I was like, if I could do that, I wouldn't be talking to you, right? And so there's just a lot of thing. And the other response, I'd get very similar to that, or instruction was like, well, you just need to designate a worry period during your day, which is like basically a time that you block. The description is a time that you would block out to worry, and then you would only worry. And I was like, okay, but like I'm worried all the time. So like the big issue for me would be 5 or 10 minutes or an hour of not worrying, and like working up from there. So just the perspective of people that haven't gone through it can be very frustrating.
The person that I do talk to is my sponsor at least every other week. I think if you surround yourself with positive people that are in your corner, one of the cliches that I heard in this program is stick with the winners, but it turns out to be does this person have what I want? I choose to have no chaos and craziness going on in my life right now. So if I see that happening, I mean, like, I want to stay away from that personally, because just negativity begets negativity, as just positivity begets positivity. You know what I mean?
So your mental health, does that affect your heart condition or vice versa?
For me, I believe personally that the physical structure of my heart and the way my blood flow is still not perfect, and was definitely not perfect while I was being formed, and even the early years of my life. That is a huge factor. And a lot of your brain when you're young, your brain is growing so much as a child. So there's nothing I can say or attest to prove it. But I am convinced that my heart condition was a contributing factor, a significant contributing factor in the fact that I have anxiety, ADHD, slightly depression, stuff like that.
I'll give you, for instance, I was placed on Wellbutrin. I don't know if y'all know this, but Wellbutrin can raise your blood pressure. That's a problem for somebody with a heart defect. So when I walk in there and I'm like, listen, I'm worried about the cardiac effects. And they say, well, yeah, it might raise it a little, but it's not that big a deal. No, it's not a big deal for a normal person. For me, it's a big deal. So this is not really a good option for me.
They can give you a low, or sometimes if kids, it's a higher dose of Ritalin, right? Which is essentially speed, if you want to look that up. But I mean, it really is. But of course, they were super hesitant to give that to me because I had a heart condition. So I'm like, well, okay, well, if I can't take a medication for ADHD and I have it, like, what am I supposed to do? Like I literally was like, am I just stuck being like marginally passing and like not doing well at work? Like it was kind of scary because I didn't know what the plan was. And thankfully the medication that I take now, it's still a stimulant, but it's like just a much lower tier. It's not speed.
When I'm in between medications that work, I really have to rely on therapy and my family and the coping mechanisms that I came up with that aren't medication. You really have to have like a very open and good communication with your doctors. You have to constantly be in contact with them about, okay, this is going to work for me for my attention or for my depression. Is it okay with cardiologist? Okay. How about the liver doctor? Okay, everybody says this is okay, so let's give it a shot. And then sometimes, you get like, yeah, it's totally fine, for cardiology, but it's gonna be harder on your liver. Or it's totally cool for that, but it's not good for your heart. Or you get like, well, it's good for all of them, but then the medication that you're already on for depression or whatever, it's going to interact. So it might all by itself be fine, but then when you put it into this whole web of everything else, it's not. It's hard to juggle. It's kind of like a full-time job just trying to do that.
I'm assuming you're constantly working on it, and some days are a struggle.
I have to put that my sobriety, even before my heart condition, even before my family, even before everything else. I put that in front of everything, because I have to work on that really vigilantly.
I'd say like my mental health for me personally has been the biggest challenge in my life, bar none. Even I'd say all my heart stuff, it's literally secondary to this.
Because it's something that you constantly are working on, have you found tips and tricks or methods of helping yourself cope with the constant need to be on top of it?
To really educate myself and be an advocate, because it makes it a lot easier when I can sit there in an appointment and tell them right off the bat, this is not going to work, or this is a concern, before I even have to go do research. Like, I already know coming in there, this is what my concerns are, or what the cardiologist is going to say.
I was isolated a lot before I figured all of this stuff out. I didn't talk about it with anybody, and that prolonged my diagnosis and treatment period, and it actually made almost everything worse. But it takes medication, training, time, and even now, just because I'm regularly engaged with just doing social things and interacting, talking with people, that improves other things. So then I'm happier, and then because I'm happier, I'm a little bit more motivated, and I procrastinate less. So it's all these things that come together, that work together for the care of a mental health, whether you have a specific disorder or not.
The best tip is to have the honesty to yourself, first of all, that you're messed up in whatever fashion it may be. It doesn't apply to anything else. Like, you can apply to relationships, you can apply it to anything else, but the honesty of just like to my own self being true, because my best thinking is not my best thinking, and literally I have to go back and go back to these steps, and I think they could work in anybody's life. Alcoholic, addict, it's just like a perfect roadmap, because it kind of takes away the feelings part of it, and it just gives you clear-cut directions on, if you just do this, it works out.
Would you mind sharing some of the positive things that CHD or your mental health diagnoses have kind of helped you with?
Oh, absolutely. That's my favorite part to talk about, because I feel like it's so like under appreciated. Dealing with this at such an early age made me realize that I can get through anything. From a very early age, I had this like grit and inner confidence that like I can do this. Like, it's going to hurt and it's going to be hard, but I can do it. And that never left me.
And have you found that those steps to sobriety have they helped you with your struggles or your connection with your CHD?
Yes, definitely. Um, it's just accepting of what's in front of you, because when I went back and had all these issues, like I had SVT episodes, and I was getting cardioverted. Like in one summer, I got cardioverted, I think like 7 or 8 times. And then having the doctor tell me that, oh, I'm going to be on blood thinners for the rest of my life. I mean, I did not want to accept that when I first heard it. And that this program of action really just gave me tools to just accept life on life's terms. That's what really I think we all struggle with, is reality on reality's terms. Is just because I can lie to myself pretty easily.
Is there anything that you would like to share with the CHD community or the mental health community, like a message?
One of the most important things that I can say is that, kind of like CHD, there isn't really like a cure for like mental illness. You just kind of get better and better at functioning the best you can.
I think my alcoholism gave me so much better tools of gratitude, because like I can always say like, this is where I was, and that gets me to a grateful point, whereas just like I'm so much better than where I was at. even with my CHD or anything like that. Just take it one day at a time. That's all we can do.
Once people start treating mental health illness like another chronic condition, there's going to be a lot more understanding and a lot more sympathy. It takes a lot of patience. If you're a lot of patience, and things are not fixed overnight, just like when you have open heart surgery, it takes months to heal. And I would say mental health, it actually takes longer to heal. And also that you're never fully healed.
I was coming up on my 4th surgery. I had to have the revision, and I was scared to death because I was, it's a huge surgery, and it's different when you're little because you don't know any different. You don't realize the risks and all that kind of stuff. But when you're adult and you know what could happen, it's terrifying. I actually went into the psych ward for like a few days because I wasn't eating, wasn't sleeping, and I was just so full of anxiety. I'm gonna get emotional here. I was talking to my dad, and he's like, you were just little. And he's like, you got up every day and you walked. And it hurt. And I know it hurt. But you did it. And he's like, you just got to find that 4-year-old again. And he was right. And I think it really, a lot of us just have to keep channeling that 4-year-old. The one that didn't care. All they wanted was to go home, and they wanted to play with their friends again. And whatever it was going to take to make that happen is what they were going to do. Channel that kid that was just like, I'm going home. Like, this is going to happen, whatever it's going to take. Let them help you because they're still in there. It's just, you're the one that says you can't, but that little kid can't wasn't a word for them.
Thank you so much, Scott. I really, really appreciate you coming on and sharing your story and your guidance for other CHDers. And thank you so much. I really appreciate it.
You're very welcome. Thank you for doing this.
You're welcome. I really appreciate you just asking me to be on here.
Thank you so much for having me. I really appreciate the ability to kind of reach some other people and maybe hopefully help them feel like they're not alone.